Dr. Daver, what is the Menin pathway in AML and why is it significant?
The Menin pathway is very recently discussed pathway. The pathway, of course, itself has been known for almost a decade. This is an epigenetic pathway. And in certain subsets of AML, such as MLL rearranged, NPM1 mutated, as well as other fusions, we find that there is a upregulation of the Menin pathway due to this rearrangement. And this actually results in increased production of two enzymes called MEIS1 and HOXA. These enzymes actually result in a differentiation blockade. So normally in the bone marrow, we have the early progenitor cells. This then leads to the pluripotent cells and leads to mature neutrophils and monocytes and blood cells. But if there's a differentiation blockade, we would see that those cells over time will start generating mutations and become leukemic cells. So one of the most physiological ways to treat late leukemia is to actually remove the differentiation blockade so the normal process of differentiation will progress. And so these menin inhibitors are able to reduce the levels of MEIS1 and HOXA. By doing this, they allow the normal differentiation cascade to progress, and they're not cytotoxic chemo or targeted chemo. They're not directly killing leukemia, but they're actually allowing the leukemic cells to then mature to normal monocytes and neutrophils. And so now there are 5 different menin inhibitors in ongoing clinical trials. 2 of these are more advanced and have shown data recently at the ASH 2020 meeting, the Syndax and Cura drugs, and are showing close to 40-50% single agent efficacy. And we believe that after the FLT3 and IDH1, IDH2 inhibitors, which have been approved in the last 5 years, the menin inhibitors are probably the next group of targeted therapies that will hopefully get approval and then eventually be used in the frontline setting in combination approaches. The activation link related to this question is that patients should be checked for arrangements like MLL rearrangement, NPM1 mutation, new fusions, as these may be amenable to therapy with the menin inhibitors. There are multiple trials with 5 different menin inhibitors, single agent and also combination trials now ongoing across multiple centers, both in the US and ex-US. And if one does have an aberration that would be sensitive to such menin inhibitor-based therapy, I would strongly recommend considering trying to get on one of those trials, because we believe that these will be the best outcomes with such targeted therapies rather than using the standard or traditional chemotherapies.